and welcome to this episode of Nutrition Science Bites. My guest today is coming from the other side of the world in Rush University in the USA, and there's a reason why I've specifically asked Dr. Puja Agarwal as a special guest on this show. But let me tell you about her first. So, she's an assistant professor in the Department of Internal Medicine at Rush University. And she actually is a nutrition epidemiologist and a nutritionist in the Rush Alzheimer Disease Centre. So today's topic is on nutrition and dementia. So that's why we've specifically asked Pooja to come along and speak to us today. Welcome.
Thank you so much for having me, Professor Collins. This is a pleasure to talk about one of my favorite topic in the world, which is diet and dementia. And I'm here to answer any of your questions and happy to talk.
Yeah. It's actually Dementia Awareness Week in Australia this
Mhm.
week. And so I thought, what a perfect opportunity to reach out to your team. But I want to let you know that we had one of our listeners email in and specifically ask us if we could talk about the mind diet and dementia. And she said that there are a number of family members who have dementia. So she really wants to get more information and wondered if this is, a diet that she should be following. And that's how I came across yourself and your whole research team, and this is a topic close to your heart, as you said, isn't it?
Yes, it is. And I've been working in this field for past almost more than almost a decade now, I would say. And I have seen the field so much evolve and people now getting so much interested in this modifiable risk factor, given dementia is such a known worldwide symptoms for condition, specifically among aging population. And it's a
Can
public
we
health concern.
Yeah, it is. But and can we start just so that we make sure, all of we're all the listeners and all of us are on the same page. Could you tell us like what is actually dementia? I think it's one of those words that people hear and you immediately feel a bit scared and a bit worried. So what does it mean when we say talk about dementia?
So dementia, I think, so as you said, it's like many things. It is more of like different general terminologies people use for different symptoms, and it can be a combination of different symptoms or any of the one symptom, such as like loss of memory, attention, your learning speed, or getting difficulty in doing your daily chores as you age, not remembering your usual directions. And there are like a lot of symptoms which come under dementia as a whole. And the most common dementia in the world is Alzheimer's dementia. There are
Right,
different neurodegenerative disorders and other factors that can cause dementia, and
right.
it is the most, uh, I would say, Alzheimer's disease by itself is the most common neurodegenerative disease among the
So
aging
that's a
population.
really so that's a really good point, because you hear people talk about dementia or they talk about Alzheimer's, but Alzheimer's is the most common form of the
Oh,
broad
dementia.
category of
Yeah.
dementias. And is there a typical age at which it onsets? Because I'm sure listeners are going, "Oh no, I couldn't find my car keys this morning. Does that mean I have dementia?" But is there a pattern of it onset, and is it like, more likely to happen at a certain age?
Uh, it's more likely to be a a condition for older adults.
Right.
However, there are few cases where they say it is an early onset of dementia due to some reasons, and like there are different risk factors. We can talk about those later, but uh, primarily among older adults. So,
Right.
so with as you age, there are certain changes in the brain which happens naturally for everybody. But for some people, there are more changes happening which are causing some kind of deposits in the brain over time. And these are called different proteinopathies and different pathologies in the brain that can eventually impact your different region in the brain that are responsible for your cognitive um, outcomes, or that can impact your motor outcomes, and eventually can impact your decision making and other stuff. So that's when the dementia is kicking off. But there's no not defined age, but people 65 and older have a higher risk. But then if we say and talk about much older population, like 85 and older, they have much more higher risk. Um,
Yeah, that
so
that
age is one of the
absolutely
risk
makes sense.
factors.
That absolutely makes sense. And I don't know whether it's just because I'm getting older that I seem to hear people talking about dementia more, but is the prevalence changing? Are more people developing dementia?
Yes, that's true too. I mean, as per the WHO report, I think in 2021 they came up with a number which was like around 28 million or so. I'm not exactly sure about that number, but they have projected that in by 2030 we will have almost 78 million people living with dementia. So that's
Yeah,
the
that's a lot.
projection. That's a lot. And then again, we have more aging population. People are living longer. Our in overall worldwide, the life expectancy is getting better. Our medical medical medicine itself has advanced so much, so people are living longer. But then there is advancement in diagnosis, there is advancement in interventions, and overall the risk is also more for people. Like there are more people like living with vascular risk factors. So by vascular, I mean diabetes and hypertension, or there are more obese people, or with more of tobacco use, or excessive alcohol use. So these are all risk factors for dementia, and there are more old people living with these risk factors.
I think that makes sense, Pooja, because you look around and you see there are lots more older people with the improvement in life expectancy. So it's kind of like what you're saying is that, well, we're living longer and we've got better medical treatment and we know about dementia, so we're looking for it, and there's more people who are likely to be detected as having it. So yes, there is a prevalence, but it's not that something weird has suddenly happened. It's more like one of the consequences of, of modern lifestyle, really.
Yeah, modern lifestyle, less of physical activity, and the diets we are eating, which we're going to talk about, I'm sure. So, yeah.
Yeah. Yeah, well, that does lead me to asking you about the risk factors because, some things you can change, I guess, and some you can't. So what are those key risk factors for dementia, for developing dementia?
So there are, I mean, you can put them in two baskets: the modifiable factors and non-modifiable risk factors. So non-modifiable is like your genetic risk factors. If you have a gene, the most prominent and the known gene for Alzheimer's or dementia is ApoE. ApoE allele. So if you have that gene, there is a higher risk of you developing the disease in future. But and so is age. I mean, as we just talked about, like
Yeah.
the older you are, more is your risk. However, there are other modifiable risk factors. And fortunately, most of them are modifiable. And there is a recent Lancet paper which actually talks about it and calls it that almost like 47% of your risk for dementia is modifiable, because
Wow.
this includes the risk like physical activity, diet, tobacco and alcohol use, your hearing loss, maintaining your blood pressure, maintaining your blood sugar levels, um, weight, maintaining your weight, the depressions in older adults, later life, social isolations, etc.
Pooja, that's a lot to remember, isn't it? So, I think something we can do, because all of our podcasts are linked to our website, No Money, No Time, we can actually put a little fact sheet there that lists
Okay.
those modifiable and non modifiable factors. Because I think some people are going, oh, hang on a minute, what can I change? And obviously, you can't change the non modifiable risk factors. But one thing that stood out to me, and this particularly relates to our listener who asked for this podcast, is
Mhm.
that explains what you said about the genetics, why for some families dementia is more prevalent. And I think you can understand then why some people in that category are going, I really want to know about those modifiable risk factors then. You know, you
Hmm.
can't change your parents, can't change, your genetic history, but the
Hmm.
modifiable risk factors, would you say then they're more important for people who have this background risk because of family history?
I think it's important for everyone
Right.
because all these modifiable risk factor prevents to you from having dementia, and people at risk might have a higher risk, but that doesn't mean people who doesn't have genetic risk factor can't have dementia. So I think it's important for everybody, more so for ApoE4 carriers. Yes.
Yes, and that's really important. Can I just ask you a quick question about the ApoE4? That's not screened for at the population level here in Australia. It's not a standard thing. I don't know if it is there in the US, but people don't necessarily know. So I think the only way they might know is if they go, oh, yeah, my grandparents, my great
Yeah.
grandparents,
Mm-hmm.
aunts and uncles. I think that's probably the main way they might
Yeah.
know they have the
The
genetic
family
history
history.
here in
Mm-hmm.
Australia, unless they've
Mm-hmm.
been referred for genetic counselling.
Yeah, I think family history is a good
So, yeah,
starting point. Mm-hmm.
yeah, yeah, yeah. And what's interesting is sometimes you actually don't know. I mean, you might be adopted, for example, but also sometimes I think people haven't asked. So I think it's a good idea to just check in. Oh, yeah. What did the generations before you, what did they get sick from as they got older? But now I specifically want to ask you about nutrition. So I know and we're going to get to the intervention you did in the Mind Diet, but in
Mm-hmm.
the observational studies, that's where, they study large populations of people and look at their diet and look whether or not they've got dementia. I think
Mm-hmm.
they're the ones that give you the clue about diet has an effect or
Mm-hmm.
doesn't have an effect.
Yeah.
What do those observational studies, how did that give you the clue about diet and get you interested in this topic? Because I know you're an epidemiologist who loves studying all of those relationships.
Yes, yes, as you said. So, yes. And then, given that we are fortunate that there are some large existing studies that have been happening since 60s or 70s and 90s. And currently, the study I work with is also an observational longitudinal cohort study, which started in late 90s at Rush, and that's called Rush Memory and Aging Project, and
Right.
that's where most of our data on diet and nutrition and dementia comes from. And all these studies, and like there are so many others, like the standard, you must have heard like the Nurses Health study that has given us a lot of nutritional epidemiological evidence on the relationship of nutrients, nutrition per se, and different risk factors or overall the health conditions. So, similarly, coming on to diet, nutrition, and dementia word, in past 2 decades, there have been a lot of studies around this topic, investigating how nutrients specifically um, are related to the dementia risk. Again, longitudinal studies are those where people are followed over a long period of time. So, for example, in Memory and Aging Project, we enroll participant without any known dementia, and then we follow them over time. Annually, we test them for cognition and motor and other things. And then eventually, in this study, they also consent to donate their brains at the time of death. So we are kind of following them until they die. So, in these kind of longitudinal study, you then know during through their clinical exam when the dementia actually happened.
Right.
So, in a way, it is, and then we are also capturing how they live or like their lifestyle factors, including diet, right from the beginning. So we know what they eat over time, and then we know how they perform clinically and on the cognitive test over
Wow.
time.
Wow.
And
So powerful.
that's how most of the nutritional epidemiological study in the field of nutrition have inferred on how different nutrients and bioactive polyphenols, etc., have been related to dementia risk. And so is our study, like others. And there is also a very well-known study from Australia that has looked into diet and dementia risk. I'm sure you and your listeners know about it. So there are different longitudinal cohort studies defining this, and initially the field was more about nutrients and specific compounds and the food groups, but now the nutrition field have moved more towards the dietary patterns. That's what we call them, like overall diet, as no nutrition is consumed in isolation. Always the foods have combination of nutrition in them, and then food is always again consumed in combination with other foods. So people have come
Yes.
up with this concept of dietary patterns, and where different food groups are put together. So there's like now a lot of studies on different dietary patterns, including the Mediterranean diet and the Mind diet, the one you mentioned initially.
Yeah. So with the study that you've done, like that's super powerful and, all kudos to the people who actually enroll and are willing to donate their brain to your study. That's pretty unusual, isn't it? So have you got any insights on the dietary patterns within the cohort study that you've been doing there? Any clues in terms of those dietary patterns and the people who cognitively were lower risk for dementia or at higher risk for dementia?
So actually, that was the study I mentioned was the one through which the mind diet was developed. I would say like most of the key factors for the mind diet were looked in this cohort, and there that's in 2015 when the first paper came in. Dr. Martha Claire Morris, who was my mentor, with her colleague at Rush, developed this mind diet, which is the Mediterranean dash. It's a hybrid of these two dietary patterns. It's MIND stands for Mediterranean Dash Intervention for Neurodegenerative Delay.
So I'm going to ask you a question now, Pooja. Everyone has heard of the Mediterranean diet in Australia, but because the DASH diet was invented in the USA and it stands for the Dietary Approaches to Stop Hypertension, it's actually
Mhm,
not very well known here in Australia, that there has been this well studied dietary pattern for lowering blood pressure. But I
mhm,
find that interesting that your observational research led you to create the merging, like the marriage of the
mhm.
Mediterranean diet with this DASH diet to try and help lower blood pressure. So, can you just tell people that might go, DASH diet? I've never heard of that. What is that? So, what are the food groups that form this Mediterranean DASH that you so beautifully described as the MIND diet? And I really think that's a great acronym too.
Yeah, I love the acronym too. So Mind has 15 dietary components. And again, it's based on these two diet patterns, the existing ones, and then it also was based on the existing literature review and scientific evidence we have for specific foods and components, like bioactive components and nutrients, including like the antioxidant nutrients, the B vitamins, folate, vitamin K, etc. And different food groups were put together. So the primary one, I'll start with the 10 healthy food components, which is like you are recommended to eat more of these healthy food components, which includes overall, vegetables. The green leafy vegetables is specifically
Mm,
emphasized in Mind diet because it is again rich in vitamin K, flavonoids, the bioactive, the essential nutrients you need for brain health. And then another important component is berries.
mm.
Berry again is one of those food components which is very unique for mind and is different from that in Mediterranean or Dash, which combines all the fruit category together. Mind is specifically
Can
for
I
berry. Mhm.
Yeah. Can I just ask, that's so interesting about the berries. Is that the category polyphenols? Because we have talked about polyphenols, so people might going, oh, it's those polyphenols again. But
Yes.
that sounds great because berries are certain times of the year. There seems to be one that's less expensive, and we get lots of frozen berries as well, which makes them cheaper too.
Yeah. So berries are a wonderful polyphenol food, and then they also are sometimes rich in vitamin C and specific flavonoids. I mean, you might have heard like the term too, flavonoids, again, a
Yes,
bioactive
yes,
compound
definitely.
in the
Yeah.
food. So
So,
berries is
so far, Pooja, it's
fruit.
sounding great.
Mhm,
Vegetables, especially green leafy,
mhm,
fruit, but especially berries. What else is
mhm.
on the menu for the mind diet?
So we have to emphasize on whole grain.
Yeah,
For sure. So again, there is a lot of literature on whole grain, on how fiber helps, and there's also literature on how now fiber can help your gut health, and gut can help your brain. So whole food, I mean whole grain is one of the components. Then the fifth one will be legumes and beans,
yeah,
which may include any kind of lentils or any such product like beans, garbanzo beans, pinto beans, or hummus, or any bean-based products.
yeah.
Then your sixth healthy component will be fish and seafood. Now, why fish? I know a lot of listeners might have heard about fish being very rich in omega-3 fatty acids.
Yeah.
And omega-3 fatty acids are one of the good fats, which are very much essential for the brain. Again, because brain is 50 to 60% lipid, and it's very essential component for brain health. So fish is the sixth component.
One of the challenges I think with fish is, some people have concerns about sustainability, but in Australia, it's actually quite expensive. But canned fish, so canned salmon, sardines, tunas,
Mhm.
they're actually the least expensive category here in Australia of fish. But does it need to come from fish? Is that what your dietary patterns research has shown? Or can people go, oh, well, I actually don't like fish, I'll just take some supplements?
So our research is primarily based on fish or seafood,
Right.
and
Okay.
not in supplements. So, I would say if I tell you the whole pattern, it's not like you have to get 100 on 100. Like you
Oh,
have to
right.
do hit
Okay.
all the 15 components. So we found that people who were doing at least like more than 9 were
Yeah.
in a good spot for
Okay.
free
Well, that's
food.
perfect then. I think everyone go, oh, thank goodness, because I don't know about doing the whole 15 and we're only up to 5. So what
Yeah.
else is in the pattern then?
Okay, so we talked about green leafy vegetables. We talked about vegetables,
Yep.
berries, whole
Yes.
grain. We talked about fish,
Yep.
and then legumes and beans. And then next one, the good category, I think most of the people might already be consuming is nuts and seeds. So primarily like the walnuts, the almonds, any kind of nuts.
Well,
Um,
that's more good news. It's all good news so far.
Yeah. So nuts is one of the components. And then the other healthy component is poultry. So
Right.
so
Chicken is
people who,
common in
who like
Australia.
consuming meat or non-vegetarian foods, so they can include poultry or turkey. I don't know how if that's very popular in Australia or not, but
It's not so
mm,
popular, but it definitely rolls around at Christmas time more so.
okay.
Now, chicken's really widely
Chicken. Hmm.
consumed. It's one of the
Yeah.
cheapest
So
meats
any
in
kind of
Australia.
chicken, obviously not the fried chicken.
Yep.
Um,
Yep. Fair enough.
Not the fried one, but the grilled, baked, broiled, any kind of seasoned chicken. That's the preferred one. Then I think another component. So I think we covered 8. Is that correct?
Yeah, we're close to. We'll put a summary in the show notes again so
Okay.
that people
Okay. So
don't have
yeah,
to
I think I'm
rewind.
I know, yes. So, and then I think another important component which people might love to hear about is wine, because
Oh,
that
really?
is one of the component of the Mediterranean diet we adapted for our population. And then we found that people who were consuming in moderation, not more, but
Yep.
moderate amount, were given a score for the mind diet. So that's one of
Yeah.
the component. And then I think one more healthy component is there, or so yeah, so the another one is olive
Oh,
oil.
right. Okay. Oh, right. Olive oil.
So
Yeah, that
olive
makes
oil,
sense.
Yeah, I mean, again, it's because of its compounds, the bioactive, the monounsaturated fatty acid, another type of good fat found in food, which is very helpful for brain health.
Yeah, and the other thing is that with olive oil, if you buy the bottle, you've got it in the cupboard and and then you can use it. It's kind of like a reminder that that's a healthier component. And the other
Mhm.
thing I think it's worth just commenting on with the Mediterranean diet, like people love it when they hear that news. Oh, wine is okay, it's not off the menu, but I think the challenge for some people is the moderation. But in the Mediterranean countries, they actually have it with food. It's not like they're sitting around
Yes.
outside just drinking wine, is it? It's
Yeah.
actually sort of almost part of a meal.
That's correct. Yes, it's more of the cultural thing. But yeah, so these are the 10 healthy food components.
Yeah, that sounds it certainly sounds tasty. And did you find were there specific foods where that relationship flipped, where you saw people who ate these other
Yeah.
things?
hmm
Yeah.
So these are the 5 unhealthy food components. So one of them is the processed meat, the red processed meats.
Yep.
Uh, and then there is any kind of fried food, like a lot of fried food. I mean, French fries are really common in the US. So
Yeah,
uh,
yeah. That kind of
that,
makes sense, doesn't it? Because foods aren't fried in olive oil. So,
yeah.
so that then
And
you're
this is
getting
like the fried oils are different. And then there's a lot of fried chicken or like fried fish, if people are consuming that kind of fried food. Then another unhealthy component is sweets and pastries. If you're having a lot
yep,
of sugar, like the
yep.
added sugar, or sucrose, or a lot of pastries and other packaged foods with high sugar content. And then we also found that people who were consuming a uh, whole fat cheese,
Oh,
because I
right.
mean, in the US, there is a lot of consumption of whole fat cheese, in on pizzas and like other kind of
Of
fast food.
course. Yes,
So,
yes.
that's recommended to be limited in your diet. That's one of the
And in
components.
fact, Pooja, that relates to what you said earlier about dietary patterns.
Mhm.
Like if you think in the US, you all eat a lot more pizza than what we do. And, so that makes sense then. It's what it's associated with. So it sounds to me, though, I'm glad we talked about the positive foods first because they all sounded really yummy. And then I think some people are going, oh, no. But am I right in that if you emphasize all those healthy foods and turn them into like delicious foods, you probably have forgotten about having some of those other foods because you're full and eating all those delicious things?
Mhm. Yeah, that's correct. Yeah.
And then the other thing I wanted to ask you, so with that mind dietary pattern, and we will put a summary so that people
Mhm.
don't have to try and remember those healthy foods and those unhealthy foods. You actually then put them together and did a research study and tested how people went with eating a mind diet. Can you tell us about that? That sounds really interesting.
Yeah, so the if we put all these components together, so what we did in our specific study from the longitudinal study, we kind of knew what all they were eating using a standard tool, and then put gave them all a score for the mind
Oh,
diet.
right.
So we created a score for them based on how much of these food categories they were eating. If they're eating healthy, they were given a positive score. If they're eating more unhealthy, they're given a negative score.
Oh, right.
So in
And
a
that was
way,
at baseline.
at baseline, and then in a way so that the score ranges from 0 to 15 because there are 15 components.
Right.
And when they were like followed up, as I told you, until the time of death, and we found that those who were eating higher mind diet had less dementia risk. It was
Yep.
almost reduced risk of about 35% for those who were eating 9 or more such healthy components from the
Wow, that's a
longitudinal.
big reduction.
That's a big reduction. And
Yeah.
also they were declining. So there is a dementia risk, and then also there's decline in cognition over time, which you can assess. So we also
Yeah.
assess. So dementia is a diagnosis, but then there's a cognition change over time, which occurs for everybody with aging. And those who were eating better mind diet had a slower decline in their regular cognition over time.
Right.
That was
Right.
another observation.
That's
Yeah.
really interesting. Can I ask you a question? Did you also, because you said you were assessing people every year, I think you
Yeah.
said, or every
Yeah.
couple of years?
hmm
Did you notice any people who changed their mind diet scores over time? Like, did
Mm,
some people start increasing and get a healthier dietary pattern? And did some people's dietary pattern
yeah. No, that's an
become
interesting
worse?
question. And I had the same question, and we looked at the data very thoroughly
Yeah.
in different ways. But believe me, like people love what they eat. In our cohort, people were not changing their diet. So,
Oh, really?
one of the reasons
Okay.
can be because they're entering the cohort when they're older. They're like all are
Yeah.
65 and older. And at baseline, there are almost everybody's 70 plus. And they
Right.
prefer what they eat. And their change over time is, I remember because we had this in our last paper, the change is just a unit of 0.02 score per year. So not even like a change in point, like
Wow.
one component in 10 year.
Wow. So
Yeah.
that's another big message for people who are getting older. It's like you need a nutrition checkup like way back in your 60s, not waiting
Yeah.
until you're
Yeah.
70,
hmm
because you get sounds to me like when it comes to diet, we get more set in our ways and
hmm
stick to the foods we know we like and we love to eat. So,
Yeah.
yeah, so there we go everyone, and I think if you know someone who's older, whatever you can do to help them eat more
hmm
healthily, because they sounded yummy like some of those foods. So that's a really, really important message. Do a nutrition checkup. So and what other research studies have you done with the mind diet then there at your university?
Okay, so as I was talking about the reduced risk of dementia with mind diet, we have
Yeah.
also looked at the pathology in the brain. Like
Yeah.
as we are collecting brain in some of these people who come for autopsy. So once we had their diet and then post mortem brains for these people, we looked at if there was an association between what they eat and what eventually we see in their brains when at the time of death. I mean, during the neuropathological evaluation, that's where a
Yeah.
certified neuropathologist will slice the brain, look at the different region, and look at the proteins and deposits in the brain, which are responsible for Alzheimer's disease,
Yeah.
dementia. And we found that people consuming higher mind diet had reduced amyloid plaques in the brain.
And they're the deposits that you were talking about that get in the wrong spot and lead to
Mhm,
that decline
mhm.
in cognition.
So so better diet had less of these deposits in the brain.
Right. And was there like a cutoff in that? Like you mentioned in the epidemiological study, people who scored 9 or more, there was a reduced risk of
Mhm.
developing
Yes,
and
that's correct.
progression. But
Mhm.
what about when it came to actually looking at those amyloid deposits in the brain? Was
Uh,
that a
and
similar thing?
That was a kind of similar thing, and we found like there was some like people who were eating in moderation, like somewhere like 7, more than 7, or more than like
Yeah.
7.5, also had better uh, brain health, but definitely those who were above 9 had a very significant difference from those who were eating less than 6
Yeah, that's so
components, for
important, isn't it?
example.
Can I just ask you one question sometimes that I wonder about? Does it matter, like, because no one, unless you live by yourself, if you've got dementia, it might be hard to remember to eat,
Yeah.
or to have all of those healthy foods. Was it protective if you live with someone else and someone else is kind of helping with the nutrition?
Yeah, I mean, that will definitely be helpful. But specifically for our studies, we are looking at people who are living independently, free
Oh,
of
right.
dementia, right? So
Oh, right.
these people don't have dementia yet. They
Oh,
develop it
wow.
over
So this is
time.
really important then. Something, because this is something positive you can do to
Yeah.
try and put the odds in your favor.
Mhm. And, additionally, we also did a trial for MIND diet. So, one
Yeah.
group was given a MIND diet, and the other group was given a low calorie, like
So
calorie
weight
restricting
reducing.
diet. Yes. And then we found like both the diet interventions, like any kind of diet intervention for these two groups, actually improved the cognition score over time for these participants after 3 years. So there's
Right.
definitely something diet is doing to the overall uh, performance and cognition in older adults.
Can I just come back to you on our intervention study? Because
Hmm.
I think, sometimes people who follow the study designs, they'll go, well, there could have been other factors in that association in the observational study. But in your
Hmm.
intervention study, are you saying you actually put people in a group? They either
Yes.
consumed the mind diet or you focused on, getting to a healthy weight, and both groups actually improved their
Hmm.
cognition there.
Yes.
Wow.
Hmm.
And would I be right if I guess that even though the weight reducing group weren't the mind diet, I bet you didn't feed them like a junk food diet in that. I bet it was still
Oh
a
yeah, yeah,
healthy diet
yeah.
in the other
Because
arm.
they were because everybody reduced like lost the weight because it was we recruited as a weight loss trial, so everybody was losing weight. Overall, I think overall there was like 4 to 5 kgs of weight loss
Right.
for
Okay. And
both
how
the
many
groups.
people were in that study?
So there were around 600 people and
Wow, that's
randomized to
huge.
two groups, 300 each, and it was
Yes.
at two sites, Chicago and Boston.
And how many years follow up was that
It was a
study?
3-year follow-up study.
Wow, they were very committed participants because
Yeah,
to stay with a
committed
research
participants
study.
and yeah, committed study staff. So,
Okay.
yeah.
So, and what you found was that essentially for both groups, doing something and eating more healthily,
Mhm.
then you actually improved your cognitive status. Did they also improve their dementia risk?
So because it's just a 3-year study and everybody
Mm,
enrolled was 65 and older, so we didn't like hit that dementia diagnosis was
yes.
not the outcome.
Yeah, it's not long
Dementia,
enough, was
yeah,
it?
yeah, it's not
Yeah.
long enough to.
But that sounds positive. And did you find that the people following the mind diet, they liked it and they were able to stick with it?
Yeah, like until the year 3, most of them were sticking to what they were eating. Although we had very intensive intervention program, our dietitians were like continuously talking to them. Like initial year was more intense intervention,
Yes.
and then we were more like follow-ups happening with both the groups. But we had a good retention in both
Yeah.
the arms.
And I think that's positive that you said both groups improved because I imagine the mind diet, they were probably closer to like
The weight loss.
like above that 9. But I
Yeah,
imagine even in the other group, because it was a healthy diet, they
yeah.
still improved from baseline. So they might have been your 9s or
Yeah,
not
they
your
were already
15s or
at
something.
8.5 or something.
Okay, so it
The control
reinforces
group.
that same message that you observed in your observational studies.
Mhm.
So, in terms of nutrition, are there any other important messages that you think people should keep in mind when it comes to nutrition and dementia risk?
I think the most important thing is I know it's not easy to change the diet if somebody's not eating some of these specific food component, but I think it's important to incorporate or take small steps at a time and try to incorporate some of these components in a way you eat your food so that it's culturally relevant to you, it's locally grown in the area, and it makes sense to you when you add to your dish. So try to emphasize on the components which apply more to your kind of I think I'll say food preferences,
Yeah,
and overall, like nutrition is important, not just for your brain health. I think one should always remember what's good for your brain is also good for your heart, is also good to maintain your vascular risk, to maintain your blood pressure, blood sugar levels. It will maintain your weight and your mood because it's also related to
yes.
your other. outcomes. So it's important for your overall well-being. It's not just
Yes.
to delay the dementia risk.
Yeah, that's a really good point. And one positive thing about our website where the podcast is hosted, Pooja, is that we actually have lots of easy, inexpensive recipes, and we'll flag some of those
Mhm.
that actually are helpful. And we also have another little resource for people who are living by themselves because they tell us they have a bit more challenges. But I really agree with you about putting some of those 15 foods or the healthy ones working out where it's acceptable for you to hide them into your food so that you're getting them, but it's
Uh-huh.
not, it's not a big deal. It's not onerous. You kind of don't even notice, but now you're making the nutrition work for you and your brain and your whole body, as you said.
Yeah.
So the last thing that I wanted you to tell us about is you have donated us a recipe, and we're going to call that, the mind friendly salad. But I want you to tell everyone, why did you pick this particular recipe that you've given us to put on No Money, No Time?
So this is a very special recipe like my mom used to force us to eat when we were little kids. And
Really?
then later I started reading about nutrition, and now given in the mind diet, I was like, oh my God, all the ingredients in this salad is actually mind friendly. So this is like the bean salad, which is very common for our house. And here I have obviously modified it with the ingredients which we now get in the US, and like so many new foods coming in. But this is a very easy recipe to put. You can add any kind of beans. I prefer like pinto beans, garbanzo is fine too. But we also do like a whole grain green or any kind of other sprouts greens or any greens. And then
Yep.
add your favorite onion, lettuce, tomatoes, radish, add all the veggies or whatever veggies you like.
What
And
you
then
like.
whatever you like, yeah, and add the greens you like, because remember,
Yeah.
leafy greens are important. They have so many nutrients and bioactive which are important for your brain health. So always try and throw in the greens or the microgreens, which are very now popular in the US. So any kind of greens, and if you want, you can also put in your chicken or some egg whites or boiled egg whites. I prefer it vegetarian, but then adding all this up with your favorite dressing was one of the best things I always remember from my childhood, because that kind of keeps you full. And then it
Yeah.
also is helping you with so many nutrients because you can, and you can modify it as per your taste. You can add crunch to it, you can add quinoa and other whole grains to it, and make it
Yeah.
more fuller or more of a meal,
Yeah.
like one pot meal kind of a thing.
Yeah, it definitely sounds like a mind-friendly recipe and sounds like if you make it for dinner, you're gonna have leftovers for lunch, which is even more perfect for No Money, No Time. Thank you so much for talking to us today from Rush University in the United States. And you've been listening to Nutrition Science Bites today with Dr. Puja Agarwal. Thank you very much.
Thank you.